EMRs and EMFs, if any? And also, what's the best couple of websites that you recommend to find out how to protect ourselves? And then I'll give you a longer one, just to clarify.
Generally, EMF applies to everything along the electromagnetic spectrum. EMR, electromagnetic radiation, typically applies to radio frequency, part of that spectrum. I've used them interchangeably, but I've been told not to. As for websites, I'd recommend, as a good resource, emfscientist.org, the International EMF Scientist Appeal. That document, which I've referred to, signed by over 200 scientists, can serve as a good educational tool. It also shows that it's not just a fringe group of scientists that are calling for precaution in a variety of, making a variety of recommendations to policymakers. I would also recommend my website, saferemr.com. I have a lot of resources on various issues, not just on cell phones, but also on smart meters and cell towers. I have some resources. And I get a lot into the politics around this, as well as the research.
Can you repeat yours?
saferemr.com. If you have my tip sheet, it's on the tip sheet at the bottom. And there's also the emfscientist.org, because I have a call for action on there.
Okay, great. And the next one we're going to go for Dr. Dunkley. She asks, have you had a chance to educate any school districts about EMF effects on kids?
Not at the district level. I'm just starting to talk to local schools, and I'd love to. I'm going to be speaking to a school in West LA soon, and I'm hoping that they will be willing to do a kind of a pilot program to see if allowing kids that are having difficulties, if they allow them to try the fast or try going screen-free, to see how it goes. It's an independent school, so they might be able to pull something like that off, and it would be good information to pass on to at the district level.
Okay, great. And this next one is for Dr. Chandra. There's a couple of questions. One, she wants to ask if there's a correlation with electromagnetic sensitivity and chemical toxicity from chemicals, heavy metals. And the same question. It's mercury from fillings, lead aluminum, how that might affect your EMF, EMR sensitivity.
I'm not familiar with the research looking at heavy metal load and EMF sensitivity. I don't know if another speaker is aware.
I had both, so but I'm not, I don't know the science. I mean, we're concerned about anytime you're changing, you're putting metals in the body, as we've talked about, it changes your conductivity, it became an antenna. And again, it's not clear whether it's cause or effect or both. It can be the effect is when you have reduced detox that your metal levels go up. But I think it really creates a death spiral, and that's what I experienced.
And clinically, that's what we see. It tends to be patients who are EMF sensitive. They don't come in and they're doing well overall. They seem to have less resilient systems, and they tend to be more sensitive to chemicals, to foods in general. And I haven't done a systematic study to see if they do have more metals in their body with heavy metals, but it is biological. It does make sense.
If I can make a comment?
I can also add to that, having interviewed a physician who treated chemically sensitive people for many years, he found that about half his patients were becoming sensitive to electromagnetic fields as well. So there seems to be a crossover. They may go in both directions.
There are effects from chemicals. I had it in my autism slides, didn't get a chance to talk about it at all, where chemicals act also to increase the activity of the NMDA receptors, which in turn increases intracellular calcium, okay? And so, and it's not just, mercury is among them, lead actually is among them, and there are probably several other metals, but there are also many other types of chemicals that do this. So they can have very similar effects, I think, to what the EMFs are doing, all working through intracellular calcium.
Okay, and to keep the mic, I'm going to have this other question for you, Dr. Paul. There were several questions about vitamin supplements and saying that if there's an oxidative problem with an inflammatory problem with the EMF, would supplements help? And what might you recommend? Somebody had asked a specific question about vitamin C, so perhaps you could answer that, or some of the other panelists as well.
You know, I could spend about an hour talking about that. The answer is yes, but let me just say, first of all, I'm a PhD, not an MD. Nothing I say should be viewed as medical advice. But, you know, we have things like hydroxycobalamin that scavenges both nitric oxide and superoxide that can be helpful. There are many other things that can be helpful, including the reduced folates. But my current sort of favorite approach is to use nutrients to raise the level of NRF2, NRF2. I have a paper on that. You can get it on the PubMed database. Just search under NRF2 and my last name, P-A-L-L, you'll find it.
All right.
What's the P?
NRF2, number 2. And my last name is P-A-L-L. Just go in the PubMed database, put those 2 in. You'll find the paper. It can be downloaded at full text at no cost.
Thank you.
Dr. Russell, can I just say that hydroxycobalamin is a particular form of vitamin B12.
Yeah.
Okay.
Okay.
Yeah, thank you.
You might not know.
Good, great, great. All righty, this one will be for Peter. There's a number of questions, and also other people can answer too, on, there's questions about improperly grounded homes. People ask about driverless cars. I don't know if you know anything about that. Let me see if I can put some of these together. Relatively, how much risk do you get from a non-grounded home or workplace? So.
Yeah, ground. Can you hear me? Most homes, a lot of homes are not even grounded at all. Grounding allows the electrical noise to go out and kind of stabilizes your current. And even the grounding systems that we have now are not really designed for the high frequency noise that we have that this technology creates. So I'm working with an audiophile, Alan Maher, who creates a lot of horizontal, a lot of high surface area grounds that are very similar to the grounds used for radar that helps dissipate high frequency noise. And that's been really helpful for reducing noise and buzzing in the house. As far as the driverless cars go, I do know that some of the frequencies being used are I think one of the scientists who was in West Bank. I don't know if anyone knows West Bank, where they have a silent area, a radio frequency silent area. One of those researchers discovered that the frequency cells were very sensitive to the frequency used for driverless cars or the anti-collision radar. So it's really a bad frequency choice. And there's a lot of bad frequency choices, but that one specifically is bad. And yeah, the driverless car thing's a big concern. We've got a friend at Stanford who literally does that, and haven't broken into him yet.
Thank you. All right, this, Peter, just a very quick one for Peter Sullivan also. It's probably, you're going to say yes. Is it worth eliminating the wireless emitter in the home and opting for a hard line?
Yes.
Short answer.
That's a short answer.
Question for Dr. Paul. Couple of these. One is wearable tech uses Bluetooth. Ellie, is this enough to open a GCC? The voltage gated calcium channels, wearable tech devices?
I don't actually know. Maybe I think Peter may know more about that than I do.
I can just tell from experience, my body's sensitive to stuff. I can be sensitive not only to the Bluetooth, the regular wireless to Bluetooth, but I can be even sensitive to batteries, even the CPU, the square waves in the CPUs that aren't even wirelessly transmitting. So it depends on how sensitive you are, but you notice I don't have any metal on my body, or I don't have anything on me right now, and I feel best that way.
I can supplement that a bit.
Good.
The blood-brain barrier penetration effect, which Dr. Paul talked about, occurs at very, very low exposures, very low SARS. It's actually a nonlinear effect. And what that does is it then enables any chemical toxins, including heavy metals that may be in your circulatory system, penetrate your brain tissue. So I would be very cautious about Bluetooth near my head.
Okay, because that was another thing. Well, this is a related question, Dr. Melswitch. People say there's a lot of focus on cell phones and cell towers, but what about remote patient monitoring devices that are radio frequency based? These devices usually have a sensor that attaches to the patient's body for data acquisition. It's transmitted wirelessly via Bluetooth or Wi-Fi. My doctor prescribed to me. I'm concerned with biological effects. So should I engage with my doctor? What precautions should I take if I decide to use these devices?
Well, obviously, there's a cost benefit there. If you need to wear one of these devices, you may really need to wear one of these devices, but there is a potential risk. Interestingly, the FCC under Wheeler recently ruled that that spectrum, I think it's channel 31, that's been dedicated to these devices, is now open for other uses. The American Hospital Association submitted formal opposition, and they were not listened to by the FCC. So this ban will become open. The concession made up by the FCC is hospitals can apply to get a zone around them that will prohibit the use of these new devices that use that frequency. I think it's like 300 yards from the hospital. But the onus will be on the hospital to apply. The onus will be on the hospital to put up these signs and to enforce it. So it's just, FCC's sort of gone amok in terms of public interest, and not just on cell towers and cell phones. A whole host of issues. It's making some really, really bad decisions. Also, these wireless mics were on a dedicated frequency. That's going to be on other frequencies. The American National Broadcasters Association opposed that ruling. The FCC went ahead and said, there's this huge demand for spectrum. There's just not enough spectrum. Everybody wants to stream video and all this stuff over the wireless, and there's just so much spectrum to be given out. So there's huge pressure on the FCC to give up all the spectrum, including a lot of spectrum reserved for the government. So now that we have government agencies fighting to protect their spectrum, which have been dedicated to them. But the money is so big that the FCC keeps conceding. And there's an excellent book on my website. It's a free book, in fact, by Norm Alster, longtime investigative journalist, spent a year at Harvard on a fellowship, and he wrote a book on regulatory capture of the FCC, and recently published it. It's also available on Amazon for like 99 cents in Kindle. But you can get a PDF off my website, safereadingart.com. Norm Alster.
All right, and thank you. The next question is for Dr. Dunkley. She writes, I find it nearly impossible to reduce my kids' screen use in large part because the schools are becoming so technology saturated and many parents and teachers think that's good. What can we do? It was like she said, I find it nearly impossible to reduce my kids' screen use in large part because the schools are becoming so technology saturated and many parents and teachers think it's good. What can we do?
Well, the first thing is to just control use at home, and you know, this is a large part of what the book is about, is how to do it at home. And there's a whole chapter dedicated to how to work with schools, how to address the school issues in the book. So I mean, I would just say, look to the book for that information. There's also information on my website at lisayourchildsbrain.com. But yeah, it's a huge issue. You can talk to the child's teacher. Sometimes teachers are open. Sometimes teachers' hands are tied. So it really depends on the school and the individual teacher.
Okay.
I want to look at Parents for Drug-Free Schools, which was a movement back in the 80s, trying to get drugs out of schools. We have a toxic pollutant in the schools now. We need to get that out of there and get the screens out of the schools as well. And I think the way to do it is through uniting with other parents at the school, starting trying to educate them about what we know about screen time and these exposures, and then organize.
Also, you know, if you ask, you know, for specific things as a trial basis to see, you know, if your child's struggling with something, if they'll be willing to do it as a trial basis, they're sometimes more open to that. But I also just encourage parents to just ask the school for accommodations, even if they say no, and keep asking, because every time, you know, the more parents that ask and the more times they ask, then eventually someone will start listening.
All right, thank you. Thank you. Excellent. We're going to have a question for Dr. Paul. And electromagnetic radiation is killing trees in the national forest, and she wonders, What do we do for urban forests? If we're finding there's evidence that in other parts of the world that trees are dying because of EMF, what do we do? What can we do?
Well, the only thing you can do is lower exposures. Let me just say, the issue of how EMFs work in plants is very interesting. It works very much the same way it works in us. There are calcium channels in the plasma membrane of plants. They're not identical to the ones we have, but they're quite similar, that have a very similar voltage sensor. That thing gets activated, it opens the channel, you get excessive calcium signaling in plants, okay? So, I mean, that doesn't really help in terms of the issue that you raised, namely how do you do it? The only way to do it is to lower exposures. I mean, that's the only way to do it.
I'll comment on that. We had a tree almost die at our house, and we had a person with a protocol called sudden life syndrome remineralize the soil, and that seemed to help actually. So there are some protective factors, but obviously lowering the radiation is going to be a key element, and that's part of our making us less sensitive too, is adding minerals to the body.
Yeah, antioxidants for your trees. All right, and Peter, question for you. No mention of dirty electricity as a source of electromagnetic radiation. What can you tell us about its prevalence and its risk?
Did you say no mention of it?
Well, just they would like you to mention it. Dirty electricity,
so,
what is it, and
yeah, that was the
prevalence and risk.
Yeah, so very prevalent. That's the thing that really upset my sleep the most of all the factors. More than the wireless was the dirty electrical noise in my bedroom. So it's kind of a complicated, I don't usually talk about that in the first 20-minute, quick 20-minute talk. The term dirty electricity is basically, if you have a nice pure sine wave, your AC electrical is not just one voltage, it's kind of a wave that happens 60 times a second. But unfortunately, there's a lot of noise and little microsurges on those waves. So if you've ever been in a building where the lights buzz, you're hearing the effects of that sort of thing and feeling it too. So it makes me feel kind of anxious and agitated. So it's a big factor, and there's nothing stopping from high frequency, microwave, any frequency from being on your wiring right now because of the way the electrical standards are, right, Tony?
Yeah.
All right.
And we have healthy buildings scientists here, and they can also
They can
answer
test for
questions.
that. There are meters for test for that, and Lloyd has been talking about new standards for that and new ways of measuring it.
Great. All right. Question for Dr. Chandra. Does the promotion of the precautionary principle imply or agree that there's still doubt? Is there doubt? And she says there's no longer doubt. So when do we use the precautionary principle, I guess? And is this assumed doubt?
It doesn't apply because we don't have.
Like,
Oh, sorry. I'm not.
oh, I'm sorry. So the question is, does a promotion of the precautionary principle imply or agree that there's still doubt?
Well, there's doubt in relationship to the more complex developmental issues I was talking about. So you can't conclusively say that EMFs cause these things, but I think there's less doubt about negative health effects from EMFs. So they're two different questions.
I don't agree with that at all. I think it's absolutely clear that the EMFs are activating these voltage-gated calcium channels. Every single one of those 26 studies shows that. So I think that we shouldn't be following the propaganda claim that this thing hasn't been shown. It has been shown.
A question.
The counterpoint, though, is there isn't scientific consensus, even among scientists who haven't been co-opted by the industry about many of these points.
Well, that may be true, but that doesn't mean that the science isn't there.
No, of course not.
I mean, it takes a while
And we
before
have to
you
go
get
get
it.
7 words from the notification about Berkeley cell phone ordinance because it says that kids are exposed to more. We have the facts,
Yeah.
but it's considered controversial because the FCC doesn't recognize it. So there's controversy around all of this stuff. It would be nice if we didn't have to rely on the precautionary principle, I agree.
Yeah, but if you were if your criterion is you don't accept anything until there's no controversy, then industry has you over the barrel forever, because they will always raise controversy. The issue ought to be where's the solid science, and that's, I think, where we need to be.
All right, thank you. I just wanted, somebody had a question here about naming the physicians that I know who treat patients with multiple chemical sensitivities. Clearly, Dr. Jelter does. And I think Dr. Chandra does, so both treat them. Dr. Chandra's here in Mountain View, and Dr. Jelcher's up in Walnut Creek. Someone wants to know how many people in this room have electromagnetic, electrohypersensitivity, if they would raise their hands if they're okay with that.
It's also called microwave sickness.
Microwave sickness. Okay, that's quite a bit. All righty. The question is, as scientists and possible health advocates, should we not recommend reducing exposure to EMF as maximally? So, I'll raise your hand. Okay. Everybody in the room will raise their hand. Okay, here is the question for Dr. Moskowitz. How to get help with school cancer clusters. She says that school districts release epidemiological reports which end investigations. How to get toxicological studies conducted. San Diego State University Brain Cancer Cluster, UC San Diego Brain Cancer Cluster, Kelly Elementary School Cancer Cluster, and La Quinta Middle School Cancer Cluster. Are you aware of any of these cancer clusters? Are you?
I've read about it.
Yeah.
I read about it. What was the question?
The question is, how do you get help with it? So if you know there's a cancer cluster, a lot of times, like they've had these clusters of health problems.
But they never admit that there is a cluster. That's
Right.
the problem. And it's complicated science to be able to determine there is a cluster, because you have to look at the population demographics and compare it to similar demographics other places. And usually the numbers aren't large enough that it'll show a significant difference. So rarely do they ever admit that there is a cluster. And I suspect politically, even if they felt there was, they'd be reluctant to say so.
Okay.
So,
Yes. Another question, we're going to just do probably a couple more and then end. There's a question here, can several cell towers around your residence produce a concentrated subset of microwaves where you live? And I guess that's a question for, everybody would agree, yes.
Yes.
There's also some concern, somebody writes here, the city of San Jose is being used as a test to place streetlights on smart meters. They're getting discounts if they place them all over the city. Suggestions on info. So apparently this wireless thing is going really crazy. All right, I think I'm going to have, I think there's one question for all. Okay, what to do in a low EMR trial? What are the things to turn off? That's a general good question to end with. People want to start with that, and anybody can answer.
So Dr. Yelvin's protocol, which is
Yes.
basically, so I'll just repeat that, it's the baby monitor if you have it, the Wi-Fi router, and then the cordless phone base station. So it's the biggest unit that usually has the answering machine. So those are the three wireless devices that are the most common. And then she is turning off the circuit breaker for the bedroom to reduce field effects and dirty electricity.
Great. I want to thank you
That's
so
it.
much.
And then well, yeah, that's the tricky thing is, so you want to just try a 2-week trial, and most people aren't going to opt out for 2 weeks. So that's what we do just for the free trial.
And smart meters, you can always call PG&E and get rid of it.
You can put shielding up on the wall that's got the smart meter.
Okay.
That's something that's useful.
Okay, good.
But, well, that gets rid of the wireless, but not the dirty electrical effects.
Right. Okay. All righty, well, I want to thank all of our panelists. Wonderful, 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 all of you.